Welcome everyone. Today's series is on general pain. Everyone will experience pain at some point in their lives. The pain could be a constant pain, intermittent pain, shooting pain, burning pain, dull pain, depending on its cause and location. Pain could be acute or chronic in nature. If it is chronic, it could present for over 3 months and can originate from any body part, muscles, bones, joints, nerves, or any internal organ. General pain, as it has been classified in my discussion today into muscular and joint pain, bone disorders, and nerve pain. We will see these disorders one by one and know about each of them, how the pain is happening in each of the disorders. First one in muscular and joint disorders is arthritis. There is pain, swelling, limitation of movement. You can see it in elderly. Everybody complaining of rheumatoid arthritis. Some kind of joint pain is there. Remember, arthritis could be classified into rheumatoid, septic, reactive, and psoriatic arthritis. So it's not just that rheumatoid arthritis, it is more than that. There is joint stiffness observed. It could be worse in the morning. Skin could turn red and hot, and if the joint is infected, the pain may cause trouble sleeping, and it generally affects the hands, knees, hips, spine. The next disorder in muscular and joint pain is polymyalgia rheumatica. Even in this condition, you find pain, stiff muscles over the shoulder and the pelvic girdle. There is intense pain. You're unable to sleep. After getting up from the sleep in the morning, uh, you feel fatigue. Night sweats are there. Severe headache. They are. This is another muscular and joint pain disease. Polymyalgia rheumatica. And it is related to giant cell arteritis, another rheumatic disorder. Next, systemic lupus erythematosus under muscular and joint pain. Although systemic lupus erythematosus is an immunological condition which has aroused, there is a butterfly-shaped rash over the nose and cheeks. It is red in color. There is skin rashes on wrist, hands, and face. But along with that, there is swollen and painful joints, extreme tiredness. Rash may be painful or itchy in nature and which could be worsened by exposure to sun. And those who face lupus, they have to always apply sunscreen and be away from the sun. That is in case of lupus. Fibromyalgia. Myalgia means muscular pain. We have seen in the previous disease polymyalgia. Poly means many and myalgia means muscular pain. Similarly, in this fibromyalgia, there is deep burning aching pain which may move around the body. You can see trigger points on the body of this lady where there is deep muscular pain which is happening, which could worse with any activity. If you're doing any kind of kitchen activity or any kind of stress you're having, or weather changes, it could result into fibromyalgia, muscle stiffness, tingling, and tiredness. Next, in muscular and joint pain disease is the Lyme's disease. Mostly the vector for Lyme's disease is a tick. It has happened because you are having that muscular pain or joint pain because of one small insect, which is that tick, where that tick has bitten you and it has produced a circular rash over the target, and it has produced symptoms like flu, fatigue, headache, neck and muscle and joint pain. So you remember what a small insect can do. That's why insect repellents are made. This has resulted, this tick has resulted into a disease called Lyme's disease. So in short, whatever I have discussed till now is muscle and joint pain. That was firstly we saw arthritis. Arthritis, it could be classified into rheumatoid, septic, reactive, and psoriatic. Then systemic lupus erythematosus, the butterfly skin rash. Then polymyalgia rheumatica, multiple areas of muscle pain. Then fibromyalgia, deep aching pain. Then in Lyme's disease due to tick-borne muscle pain or joint pain is there. Next we come to bone disorder. The bone disorder in this you can see is a limbs, lower limbs, you can see the legs. One is a normal one is due to Paget's. Paget's Pages affect, it actually can affect any bone in the body, but normally affects the pelvis or the collarbone, spine, or the most specifically the leg bones. The bones become painful, weak, and may happen with fractures, and arthritis may also develop. This can occur in both male and female, and it is rare actually. It is after 55 you may face this kind of a disease called Paget's. So you might need an ortho or a bone doctor in this case, in case of Paget's. So you have to be careful how to look after your joints and your bones after 55 years of age, what it can result into. Next is nerve pain. Nerve pain, you can see the nerve cells in both of these images. One is a healthy neuron and another one is of a neuron of a diabetic person. In a diabetic person, there could be a burning, shooting pain, tingling, numbness, loss of coordination, sometimes fall. It can affect feet and legs. In diabetes, there is poor control over the glucose levels. So if too much glucose is there, then neurons will get damaged and it could lead into nervous pain, means the nerve pain due to diabetes. And that nerve pain due to diabetes is called diabetic neuropathy. Next in nerve pain is peripheral neuropathy. If you find symptoms like uh, pins or needles, as although it is not present in reality, but you're feeling that there is some pin-like sensation or a ant-like moving, tingling, numbness sensation over the feet or burning sensation, and you cannot feel the ground, loss of balance. This happens in peripheral neuropathy. Again, it is a disorder which has affected your nerve fibers. There is burning, shooting pain, tingling, numbness, loss of coordination. It may lead into fall. It affects feet and legs, sometimes hands and arms. So this has resulted, it is not due to diabetes. This is due to periphery. Periphery, your nerves are getting affected, the mostly of the hands and arms, commonly of the hands, arms, feet and legs. commonly of feet and legs. Next in nerve pain is the nutritional neuropathy. If you're lacking in some kind of nutrition, it could lead to burning, shooting pain, tingling, numbness kind of sensation. Symptoms may begin from the tips of fingers, toes, and may slowly progress to all the limbs. Sore, red tongue, anemia could be there. There could be fatigue. If you're not taking good nutritional diet, then it could lead into anemia, first sign. That was in case of nutritional neuropathy. So in that case, you take dietary intake, take good dietary intake to proper it. Next in nerve pain is complex regional pain. There is severe persistent pain triggered by the injury, usually affecting a single limb. Overlying skin may be tender, red, swollen, or stiff. Regional pain syndrome. It is happening at one particular region only. There is no causative factor behind it, but it is due to the nerve pain. Next comes is pain arising due to cancer or tumor. If you are having any kind of tumor, or if you face a tumor inside some part of the internal organ, then that part will face pain. If you're having bone cancer, then it will have dull aches, which may be over the bones, or if you're having brain tumor, you'll have frequent severe headache. If it is a breast cancer is usually not painful, but if there is colon cancer, then there could be blockage to the passage of feces, which could lead to cramping, abdominal pain. Or if there is tumor growing inside a kidney, there could be pain on the lower and back side of the body. So cancer can cause pain in different parts of the body. That's the influence of this. Lastly, whatever we saw in this, pain due to bone disorders like Paget's. Then in nerve pain, we saw diabetic neuropathy, peripheral neuropathy. You can see in pink, nutritional neuropathy and complex regional neuropathy, and a pain due to cancer like bone, brain, colon, and kidney. That's all for today. Thank you for watching.